multiple myeloma is a blood cancer, and it affects the blood and the bones. It is the second most common blood cancer, the first being lymphoma, and the third being leukemia. So it develops in the in the bone marrow. Our bone marrow is that sponge tissue, in the center of our bones. So normally the bone marrow is responsible for producing all the cells that we see when we do our CBC, the red cells, the white cells, and the platelets. And it's like a factory, right? So it's able to pump out all these different types of cells that help us to live our daily lives. The white cells and the red cells and the platelets. And so multiple myeloma affect one of those type of white cells called the plasma cells. The plasma cell represent 2% of our white cell. And normally the plasma cells help to fight infection. So they produce a protein called immunoglobulin that help fight infection when we have a cold or other things. Those, proteins, plasma cells proliferate. Well, in multiple myeloma, those plasma cells become abnormal. Just something tells them to just keep reproducing and reproducing abnormally. And so it can crowd the, the entire, bone marrow space and prevent healthy cells, the red cells, the normal healthy cells, and the platelets to work. And so our immune system can stop, working. And left unchecked, these abnormal plasma cells, now called myeloma cells, can cause a lot of, problems. And they can actually attack the bones and release calcium. And patients can get very, very confused. They actually can attack the kidneys, where, patient, the kidney protein production in the kidney is abnormal, and there's a lot of abnormal proteins being secreted from the kidneys, and patients can have a lot of foam in the urine, and patients can actually end up on dialysis as a result of this.